In this video, we'll be talking about the major component of blood, the erythrocytes. Erythrocyte is a more technical term for a red blood cell. It's right there in the name. The prefix erythro means red, and cyte, of course, means cell. So you've got your red cells, or your red blood cells. Erythrocytes are strange-looking cells. They have what's called a biconcave structure, and that just means that they curve in on both the top and the bottom of the red blood cell. I like to think of it as like a Werther's lozenge. They look a little bit like a Werther's lozenge. This biconcave structure is actually very useful for the red blood cells. It gives them a really large surface area for gas exchange, so plenty of oxygen can diffuse into the erythrocytes and back out. It also allows the erythrocytes to form stacks called rouleaus that allow these red blood cells to pass through very narrow capillaries. These images show you what the rouleaus look like. It's French, so singular is rouleau without the X, plural is rouleaus with the X. You can see some nice rouleau and a very narrow capillary right here. Notice how the capillary is barely wider than a single red blood cell. And here's another nice rouleau. This is the cartoon version of the rouleaus. Rouleaus form more readily when there are more proteins in the blood. This happens when you have tissue damage, and it happens when you have inflammation. If you've ever heard of a type of blood test called a sed rate, the sed rate is the sedimentation rate, the erythrocyte sedimentation rate. It's the distance that red blood cells in whole blood settle over an hour. So if you take a tube of whole blood, let it sit for an hour, the sed rate is how far the red blood cells sink. Red blood cells in these stacks called rouleaus, the stacks are denser, so the red blood cells settle faster. So you see an elevated sed rate in inflammation. So when you have a patient with chronic inflammatory conditions, they'll have an elevated sed rate. Now, the reason why red blood cells can take on this biconcave shape is because they are anucleate. Anucleate means that the red blood cells have no nucleus. In fact, they have essentially no organelles. No nucleus, no to very little mitochondria. They're basically just these little lozenge-shaped bags of hemoglobin. Hemoglobin is the protein complex that allows red blood cells to transport oxygen. Hemoglobin is what holds the oxygen in a red blood cell. No nucleus, no mitochondria means that there's more room for hemoglobin. It also means that erythrocytes have a limited lifespan. They only survive for about 4 months before they're recycled in the spleen. And it means that they need glucose in order to survive. With no mitochondria, they have to get their ATP through lactic acid fermentation, and they can only use glucose as an energy source. You can measure the amount of red blood cells in a person's blood by taking their hematocrit. A hematocrit is a blood test that measures the percentage of whole blood volume taken up by erythrocytes. So if you take a tube of whole blood and you spin it down, what percent of that volume is going to be made up by those erythrocytes down at the bottom. On average, it's about 45%, but of course there is a range of normal values. So normal is considered somewhere in between about 37% to 54%. So around half. The hematocrit is usually a bit lower in women than in men, in part because women, if they're menstruating, they're losing They're losing some red blood cells on a regular basis, but also because the androgens, male sex hormones, actually stimulate red blood cell production, very secondary effect. So males make a little more red blood cells than females do. So hemoglobin is the protein complex that carries oxygen. It's obviously very vital to the function of red blood cells, since that's what they're there for, is to carry oxygen. This is what hemoglobin looks like. We have the somewhat cartoony chemical structure version over here. Hemoglobin is made up of 4 protein chains, 4 polypeptide chains. You have the 2 alpha globin chains. There's one and there's the other. And you have 2 beta globin chains. It's one, and there's the other. Each polypeptide, each alpha chain, and each beta chain contains a central heme group. And that's what you're looking at over here. This is the heme group. And at the center, in the very middle of this heme group, is an iron atom. And it's this iron atom that actually binds to oxygen. One iron atom in a heme group binds reversibly with 1 molecule of oxygen. It's not a covalent bond, it's reversible, which is really important because you want oxygen to be able to get off of that iron atom, out of that heme group, out of the hemoglobin, and diffuse into the tissues that need that oxygen. Now, it's not really an important function of hemoglobin, but hemoglobin is what gives blood its color. When hemoglobin is bound to oxygen, that's called oxyhemoglobin. It's a bright ruby red. When it's deoxygenated, so when there's no oxygen, hemoglobin is a dark brick red. It's convention to color deoxygenated blood blue, and you'll see that online in your textbook. You'll see that in all sorts of locations. But really, deoxygenated blood is just a darker red. Now, since hemoglobin is so vital to the function of red blood cells, and the function of red blood cells is so vital to your body, things can go pretty wrong when there's a mutation in hemoglobin, when a person's hemoglobin is abnormal. The term anemia is a more general term. Specifically, anytime you hear the term anemia, it means that the blood cannot carry enough oxygen to supply the tissues. There's a particular type of anemia that is actually genetic. Many anemias are diet-related, but sickle cell anemia is actually genetic, and it's caused when you have hemoglobin, abnormal hemoglobin, that has a mutation in it. It's actually a mutation in the beta globin chain, and this mutated hemoglobin, it's fine, it works fine when there's oxygen around, but under hypoxic conditions, so when there's low levels of oxygen, and that term I just use is hypoxic, that just means low oxygen levels. So, under hypoxic conditions, the hemoglobin straightens out, causes the red blood cells to straighten out and form this sickled shape, this really spiky, pointy shape. And this spiky, pointy shape does not pass easily through small blood vessels. They clump together and they block blood flow through small blood vessels. That lack of oxygen getting to the tissues because the blood vessels are blocked, that can cause really acute, really painful episodes. I've heard it described as feeling like you have an elephant standing on your chest. Interestingly, you actually have 2 versions of hemoglobin in your body, in your genes. There's the adult hemoglobin gene and the fetal hemoglobin gene. The fetal hemoglobin gene works just like adult hemoglobin, except that it holds on to oxygen a little bit tighter. This allows the fetus to steal oxygen away from its mothers. hemoglobin. And there is a new treatment for sickle cell. It's a relatively new treatment that uses a drug called hydroxyurea to turn on synthesis of the fetal hemoglobin gene. Normally you stop making fetal hemoglobin after you're born. You start making the adult version. But if you can turn back on the fetal hemoglobin gene, in patients with sickle cell anemia, that fetal hemoglobin gene is just fine. There's no mutations in it. So it's thought that, and they're seeing some success with turning on synthesis of fetal hemoglobin in sickle cell patients. Now, sickle cell anemia is not the only genetic disorder of hemoglobin. You also have thalassemias. Thalassemias can be caused by a genetic mutation in either the alpha or the beta globin chains. And this this mutation, so it's in the same protein, but it's a slightly different mutation, and the hemoglobin just can't be made. So you end up with red blood cells that are very delicate, very thin, and don't have enough hemoglobin to carry oxygen, to carry enough oxygen. Now, erythrocytes, like all of the blood cells, are made in the red bone marrow. If you remember from the skeletal system, there are two types of bone marrow. Yellow bone marrow is basically adipose tissue. Red bone marrow is the hematopoietic tissue. There, hematopoietic. That means making blood cells. You're looking at a cross-section of a bone here. You can see the compact bone around the edge, and if you zoom in, you see the trabeculae of the spongy bone. There and there. And all of this material in here is the red bone marrow, right? And this bone marrow contains sinusoids, which are capillaries, so really small blood vessels, but sinusoids are a special type of capillary that are very, very wide and very, very permeable. So they're just perfect for picking up all of the blood cells that are made in bone marrow. Haematopoiesis is the process of blood cell formation. Erythropoiesis is the process of erythrocyte formation, specifically. Like I said, happens in the red bone marrow, and it takes approximately 2 weeks, about 15 days, to make a red blood cell. I don't expect you to memorize the exact specific details step by step by step, but I do want you to understand that the erythrocytes, they come from a stem cell, a hematopoietic stem cell. A stem cell is any cell that divides, and when it divides, one copy remains a stem cell, and the other copy develops, matures into a different type of cell. In the hematopoietic stem cell, one line, some of its daughter cells, can become erythrocytes. They pass through early stages. As you go from left to right here, the cells are getting more mature. The hematopoietic stem cell is very immature, right? So one daughter cell from that hematopoietic stem cell, it passes into the slightly more mature proerythroblast, into the erythroblast, keeps maturing, eventually casts out its nucleus and becomes a reticulocyte. And then the reticulocyte matures into an erythrocyte. Now, a reticulocyte has about 80% of the hemoglobin is found in mature red blood cells. So it's on its way, but it's not quite there. And you do find some reticulocytes kicked out into the blood, but typically less than 1% of the red blood cells in a healthy individual are reticulocytes. So almost all of the red blood cells in your blood are these mature erythrocytes. Measuring the amount of reticulocytes in the blood can actually be useful clinically. If a patient is bleeding a lot, they will have elevated levels of reticulocytes because their red bone marrow is trying to replace the blood that was lost. Also, there are certain types of anemia where where the red bone marrow keeps trying to bump up the red blood cell count, keeps trying to increase the oxygen carrying capacity, so it's kicking out immature red blood cells. And you can see it after a move to high altitude as your body is adjusting to the lower oxygen level in the atmosphere. So under all those conditions, you'd see a high reticulocyte count. A low reticulocyte count may indicate something going wrong with the bone marrow, or certain types of anemia, like iron deficiency anemia, gives you a low reticulocyte count. Some forms of chronic infection and some medications, like chemotherapy medicines, can cause a low reticulocyte count as well. Erythropoiesis is something that your body keeps in careful balance. It's definitely a homeostasis situation. You have to have enough red blood cells, but not too many. If you have too many red blood cells, your blood becomes too viscous or too thick. Too many red blood cells is a condition called polycythemia. Polycythemia can be normal under conditions where you need more red blood cells, like if you just moved to a high altitude, or if you have some sort of lung disease that keeps your lungs from taking in enough oxygen. However, polycythemia can also indicate a problem with the bone marrow, a cancer of the bone marrow that causes overproduction of red blood cells. Now, if you have too few red blood cells, of course you can't transport enough oxygen to get to all of your tissues. When this diagram shows the maintenance of red blood cell levels, when you have a low oxygen stimulus, so hypoxia, for whatever reason, because of a decreased red blood cell count, decreased hemoglobin, decreased amounts of oxygen, this is what's happening when you're at high altitudes, that triggers your kidney and, to an extent, the liver to release erythropoietin. Erythropoietin is a hormone that stimulates production of red blood cells. You may know it from discussions on sports doping as EPO. Some athletes take it as a drug to boost their red blood cell production, so that giving them better endurance. At least that's the idea. Erythropoietin acts on the red bone marrow, tells the red bone marrow to kick out more red blood cells, and that brings the oxygen carrying capacity of the blood back to normal levels. Erythropoiesis requires a healthy diet. There are a number of elements that you need in your diet in order to maintain healthy red blood cells. First of all, you need the basic building blocks, the proteins, lipids, and carbohydrates that provide the carbon and the amino acid that you need to build protein. Really, you need proteins, lipids, and carbohydrates to build just about anything in the body. For erythropoiesis, more specifically, you need iron. About 65%, so significantly more than half of the body's iron is in the hemoglobin. You need a lot of iron to produce hemoglobin. You have some iron stored in liver and spleen cells, a little bit in bone marrow. There are complexes called ferritin and hemosiderin that store iron within cells. And iron in the blood, there are small amounts of free circulating iron that's bound to a transport protein called transferrin. There are also vitamins that you need in order to produce erythrocytes. Vitamin B12 and folate are primary ones. B12 and folate work together to make DNA. So anytime you are making new cells, you need to make a copy of your genetic material. And since your red blood cells have such a high rate of turnover, remember that they only live for about 4 months. If you are deficient in vitamin B12 and folate, your red blood cells will show this pretty quickly. Deficiency in iron, B12, or folate in the diet can lead to anemia. Iron deficiency anemia leads to what's called microcytic anemia. The red blood cells are smaller than usual and pale. The hemoglobin that's made is normal, but you make much, much less of it. So there's normal hemoglobin structure, but much less. In pernicious anemia is due to a vitamin B12 deficiency. It can also be caused by a deficiency in a protein called intrinsic factor, because intrinsic factor is necessary to absorb vitamin B12. So if you don't make intrinsic factor, you can't get enough vitamin B12. Your body can't take it in. And this happens often. You see this in the elderly, because the elderly intrinsic factor is made by the stomach, and the elderly stomach can get inflamed and stop producing intrinsic factor. Pernicious anemia is a macrocytic anemia, where the erythroblasts grow in size, but they can't divide because they can't copy their DNA without vitamin B12. The red blood cells that are there, they have a normal hemoglobin quantity, so they've got normal amounts of hemoglobin. Hemoglobin production isn't faulty, but the numbers of red blood cells are low, and the red blood cells are oversized. Folate deficiency anemia, since B12 and folate work together, folate deficiency anemia looks very similar to pernicious anemia, and in fact it's a little bit more common than B12 deficiency. Like I said, red blood cells only live for about 4 months, 100 to 120 days. When the red blood cells become older, they accumulate damage, and as they accumulate damage, they get trapped in the spleen, and in the liver and bone marrow as well, but primarily the spleen. The spleen is the red blood cell graveyard. All right? Once these red blood cells are trapped, they're phagocytosed by macrophages. Right? So there's macrophages. If you think of the spleen as like a little net catching worn-out red blood cells, there's macrophages sitting in that net to break them down. So macrophages, they phagocytose the red blood cells, digest the red blood cells into pieces, and the building blocks of the red blood cells can then be used to build new cells. The hemoglobin needs to be treated a little bit specially. So when hemoglobin is broken down, it's broken down into the protein component, globin, and the heme groups. Okay, so the globin is just protein. It's broken down to its amino acids, and those amino acids are put back into circulation for reuse. The heme group, the iron is stored as ferritin and hemosiderin, and then released into the blood so that it can traffic back to the red bone marrow for erythropoiesis, so it can be recycled. Bilirubin, the rest of the heme group, is actually excreted. Okay, so bilirubin is processed in the liver. It's picked up from the blood, and then the liver puts bilirubin into bile. The liver makes bile, and then that bile is secreted into the intestine, metabolized by the bacteria in your intestine, and excreted in the feces. So the bilirubin is excreted in your feces. Fun fact, it's what makes your feces brown. And iron and amino acids are recycled. It's the accumulation of bilirubin that makes your skin start to look yellow, that leads to jaundice, the appearance of jaundice during liver failure. and it's bilirubin that's responsible for neonatal jaundice. Before birth, the placenta takes bilirubin out of the fetus's blood and returns it to the mom's blood for breakdown. The baby's liver takes it over after birth, but it can be a little bit slow. It can take a little bit of time for the liver to catch up, especially in preterm births. That's why if you've ever known a baby with neonatal jaundice, they recommend light therapy. Light therapy helps break the bilirubin down molecularly to a form that can be more easily excreted. We've talked about several red blood cell disorders already. We've talked about sickle cell anemia and thalassemia due to abnormal hemoglobin. We've talked about the dietary anemias. You can also get anemia caused by blood loss, so it's called hemorrhagic anemia. You might think that usually you'd notice if you have blood loss, and it's true with acute blood loss you usually would, but if you have blood loss within the body, like say a bleeding ulcer in the gastrointestinal tract, you might not necessarily realize that you're bleeding, but that blood is coming out of your blood vessels into your intestinal tract and you're losing it. And over time, this blood loss can lead to hemorrhagic anemia. You can also get hemolytic anemia, where the red blood cells are just lysed, just burst. And hemolytic anemia happens, and there are some infections that do it, but it can also happen if you have a mismatched blood transfusion. So hemolytic anemia is part of the reason why blood typing is so important. Aplastic anemia may be caused by exposure to radiation or exposure to certain drugs, like during chemotherapy. Radiation and chemotherapy drugs destroy the red bone marrow. So aplastic anemia is something that's seen in cancer treatment. And with aplastic anemia, you see a loss of red blood cells, but since you're destroying all of the red bone marrow, you actually see lowered numbers of leukocytes, your white blood cells, and of your platelets as well. Now, we talked a little bit about polycythemia, which is an excess of erythrocytes. It can be problematic because your blood flow slows down as your blood gets thicker. Like I said, some polycythemias are more normal. You see, these are called secondary polycythemias. They occur naturally at high altitudes and may not indicate disease. But there is a bone marrow cancer called polycythemia vera that causes excess production of red blood cells and can be problematic. You may also sometimes see overproduction of white blood cells and platelets in this disorder as well. Okay, after studying this video, you should be able to answer these questions. Talk about the structure and function of erythrocytes, talk about hemoglobin, the life cycle of red blood cells, the role of the kidney, and talk about the variety of ways that anemia can happen.